Welcome again to Healing Heart to Heart. I'd like to introduce you to Tammy Ochoa-Billings, outpatient clinical social worker for San Juan Health Partners. Tammy is available to support any San Juan Health Partners patient. You can reach her by calling 505-609-2038. Tammy, please share some of your thoughts on healing after the tragedy that befell our community.
Well, the first thing that comes to mind is making sure that we, can provide as much support for everyone who comes into our clinics. Many times it's going to present as sicknesses, stomach aches, inability to sleep, which then causes sometimes headaches. Again, feeling of sickness, and the majority, shouldn't say majority, but many of our patients will be our pediatrics patients, and parents not knowing exactly how to handle, what to do, what to say. So being available for anyone during this time especially.
And this community is approaching the holidays and is exhausted. Students are exhausted, parents are exhausted, teachers and staff. Do you have any advice on how people can care for themselves and care for each other now that we've moved beyond all of the obvious activities and support like the bonfire?
And there are so many different things. Obviously this is a huge traumatic event that happened and a huge tragedy to our area. But I say this with all of my patients who may be dealing with other things as well. The first thing is always remember that you are drinking plenty of water, and that you continue to eat, regular meals, because once you start, messing with that, you start getting other symptoms. But also the second part of that is knowing who your support system is, knowing who you have available, whether it's grandma, aunt, uncle, brother, sister, neighbor, knowing who you have, almost like a toolbox, knowing who you have available to you at the time. And that's why, as a social worker here at San Juan Health Partners, I can be one of those people, whenever they come to the office and say, I don't have, my family lives over here, or, my mom and dad are not together, and I just don't know who to, I can be a new support person to kind of help them and guide them. But the biggest thing right now, honestly, is really, like you're saying, take care of yourself. And sometimes it's as easy as making sure you're drinking enough water, getting enough sleep. But sometimes with things like this, that's hard as well. So.
Do you have any advice on speaking now to teens and parents who sometimes don't know? When should I ask for help or not? Am I bothering people? Is my problem big enough? Do you have any advice on encouraging people to get that support, or how to go about asking for it?
Well, that's the hardest part. Sometimes we feel that we don't need to ask for help. And sometimes that's the hardest step to make. It's kind of like, when I did adventure-based therapy, when we did rappelling, the hardest part is taking that one step off that ledge. But then after that, it's like, oh my gosh. So really, ask. If it is your doctor, ask your doctor. But you have to be able to ask for that help. For parents, though, sometimes, here's the hard part. Sometimes you'll have two different types of parents. You'll have the one parent that, is always asking and the kiddo going, I'm fine, or you'll have the other parent that really doesn't know how to ask. So I think a part of it is educating on how adults, they manage and cope with situations like this different than children do. And helping them, sometimes honestly it's education, helping them understand that if they don't want to talk about it right now, that's normal. Whereas parents, we want to talk about it right now. Children, sometimes they're still processing and they're not quite sure, but that's where you're going to see some of the other things. Maybe excessive sleeping, not eating, not sleeping. I think I said that already, but you're going to start seeing those things. So a part of it really is educating, the parents on what they're going to see, and same for the students and adolescents. They need to know what they're going to start experiencing, because it's going to be a huge range. And that's one of the biggest things. You know, having groups, I know whenever this first happened, there were a lot of clinics that had groups. Groups are a great experience for some, not all. Some people aren't comfortable with groups, but honestly, when they start hearing how other people are feeling, it really allows them to feel like, oh my gosh, I'm not the only one feeling that way. You know, and kind of hearing how other people manage, because, you know, we don't have obviously a social worker, but everyone, there isn't a textbook that says what you should or shouldn't do, and everyone's going to respond differently. But the biggest thing is knowing honestly who your support system is, whether it's church, counseling services. There are a range of counseling services. A social worker at your medical facility, aunts, uncles. You know, just having that toolbox available for you for sure.
What do you think about teens who maybe don't want to re-engage in their activities, like their clubs? And that's understandable if they're exhausted or confused or depressed. What things do you think they can do to encourage themselves to re-engage when they really don't feel like it or can't concentrate on their homework and that type of thing?
There are so many different things to do. I mean, I guess, especially in Aztec, you know, many of the clubs, I think, have tried to come together to be that support group. Because when you're in a club like that or in sports, I mean, that's your family, you know. So having them come together at that point. The other thing, if you're at home, you know what really works well also is trying to remember what was it about that you liked. You know, remembering how that made you feel. Remembering that, you know what, I really like this. But then again, sometimes you have to talk to someone and talk it through about why are you afraid to go back, and really finding that trigger point and then start working through that to get back to what you love.
Thanks so much for mentioning the importance of re-engaging with what you love and of understanding that re-engaging with what you love and enjoying life in no way means that you don't honor or haven't been changed by what happens. And I thank you, Tammy, for your wisdom and for your generous spirit and for sharing your healing heart to heart.
Thank you.